Today we are going to discuss few questions about the topic the client with lower gastrointestinal tract health problems. So without any delay, let's begin the questions. The first one is which of the following is a potential risk factor for the development of colon cancer? We all know what is colon cancer. Do you know what is the most common site? The most common site for colon cancer is sigmoid colon, and for screening purposes the best modality is colonoscopy. Talking about the risk factors, the most common are alcohol, high fat diet rich in red meat, polyps, especially the colorectal polyps, then IBD, and IBD is inflammatory bowel disease, in which ulcerative colitis is more dangerous than Crohn's, then deficiency of the enzyme selenium, then family history of colorectal cancer. These are the few risk factors for colon cancer. Talking about the protective factors, here we have NSAIDs, then selenium, and diet rich in high roughage or fiber. So these three are the protective factors for colon cancer. Now in questions they are asking about the potential risk factor. Chronic constipation. Well, chronic constipation is a consequence of colon cancer, but it is not a risk factor. So this is not correct. Second is long term use of laxatives. Laxatives are rich in fibers, so they are actually a protective factor for colon cancer. So it is not right. Third one is history of smoking. Smoking has nothing to do with colon cancer. So third one is also wrong. Fourth one is history of inflammatory bowel disease. I already told you that a history of inflammatory bowel disease is a risk factor for development of colon cancer. And in inflammatory bowel disease, ulcerative colitis has more incidence for colon cancer as compared to Crohn's. So the correct option is fourth one. Now moving to the next question, and that is a client with colon cancer is having a barium enema. The nurse should instruct the client to take which of the following after the procedure is completed. So, why we give barium enema to the patient? Why barium enema is given to the patient? Barium enema is given to find if there is any inflammation or presence of any polyp or any structural changes in the intestine, or to find out any cancerous site in the colon. So, these are the reasons why barium enema is given in the patient. Now, other reasons are that barium enema is a less risky procedure, and it is also less expensive as compared to other procedures, like as compared to colonoscopy. And now, what do we give in barium enema? We give barium sulfate. Now, students, it is a good question. They can ask what is the substance that we give during barium enema. Barium sulfate is given after the procedure is completed. What happens is a small amount is expelled immediately from the intestine and the amount that is left behind, it may cause constipation in the patient. So, to remove it, what we suggest to the client, this is what they are asking in the question. First one is laxative. Well, laxative is rich in fibers and it helps in relieving constipation, which is caused by the retained barium enema in the client's stomach. So, laxative is right so far. Second option is anticholinergics. Anticholinergic drugs, they decrease GI motility. So, the passage of the barium enema will be further delayed. So, this is not right. The third option is antacids. Antacid decreases gastric secretions. Antacids decrease gastric secretion, so they delay gastric emptying. They delay gastric emptying. So third option is also not correct. Fourth one is demulcent. Demulcents are used to treat diarrhea as they soothe muscle membranes of the GIT. So they have no role in expulsion of the barium enema from the stomach. So the correct option is first one, and that is laxatives. Now moving to the next question. The client with colon cancer has an abdominal perineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-operative period? Now, before reading the options, what is abdominal perineal resection? It is a procedure that we do in case of colon cancer. And in this procedure of abdominoperineal resection, the entire anal canal, rectum, and part of sigmoid colon is removed. So in APR, we remove anal canal, rectum, and a part of sigmoid colon. This is the procedure of APR. And then the perineum is closed. Perineum is closed after that, and a permanent colostomy is taken out. So this is the procedure of APR. Now let's read the options. They are asking which of the following nursing interventions is most appropriate for this client in the post-operative period. So maintain the client in a semi-Fowler's position. Now what is semi-Fowler's position? It is this position, basically where bed position where head of the bed is elevated 15 to 45 degrees as compared to the base. This is semi-Fowler's position. And what is Fowler's position? In Fowler's position, the bed position wherein head of the bed is elevated 45 to 60 degree, right? So, but so if we lie the patient in a semi-Fowler's position, it will not, the patient will not feel as comfortable, as the patient will be feeling more comfortable with side lying position because of the incision that is present around the perineum. So first option is not correct. Second option, assess the client with warm sits baths. Well, the appropriate nursing intervention after this abdominoperineal section include assisting the client with warm sits bath 3 to 4 times a day to keep the incision clean to prevent any infection. So basically, second option is correct so far. Third option is administer 30 ml of milk of magnesia to stimulate peristalsis. No, it is inappropriate to give a milk of magnesia to stimulate peristalsis to the patient. Third option is also wrong. Fourth one, remove the ostomy pouch as needed so the stoma can be assessed. It is not necessary to change the pouch daily because the pouch that we are using in ostomy, it should be transparent. It should be a transparent pouch. Why transparent? So that we can easily observe the stoma and if the drainage is happening or not. So the pouch should be transparent so that we need not remove the stoma, we ostomy pouch, so to assess the stoma. Another question is, the nurse assess the client's stoma during the initial post-operative period. Which of the following observations should be reported immediately to the physician? Before starting the question, let's read what is stoma. Stoma is a small opening that is made in the abdomen, which is used to remove body waste such as feces and urine into a collection bag. This is stoma. Now, what are the prerequisites for creating a stoma? An opening is made in the rectus sheath muscle. Opening is made in the rectus sheath muscle and it is made at outer border of the rectus sheath. It should be away from bony landmarks and it should be away from the belt of the patient. So these are the prerequisites that are required before creating a stoma. Then depending on the opening of the stoma, it is of three types. Number one is single barrel stoma or which we call as end stoma. It has one opening. Second is double barrel stoma. It has two openings and these two openings are not joined. Not joined. Third is loop stoma. Loop stoma also has two openings but they are joined with each other. So it is the basic difference between the double barrel stoma and loop stoma. Double barrel stoma also has two openings but they are not joined, and in loop stoma it also has two openings but they both are joined to each other. Right. Now talking about the complications of the stoma. First one is fluid and electrolyte imbalance. Second one is skin excoriation. Third is prolapse of the stoma. Fourth is retraction of the stoma. Fifth is necrosis, and necrosis is the earliest complication in the client with stoma. Earliest. Then there is parastomal herniation. that is the bowel from the abdomen comes out from the space around the stoma. It is called parastomal herniation. These are the few complications that a client with stoma can have. Now, what they are asking us in the question is which of the following observations should be reported immediately to the physician? The stoma is slightly edematous. Well, if the client is having mild edema, it is quite normal. So, the nurse should not report this to the physician. Second is stoma is dark red to purple. Dark red to purple. What does it suggest? It suggests that the opening of the stoma is too tight. And if the opening of the stoma is too tight, it can definitely lead to necrosis. So, the nurse should report this one immediately to the physician. So, the correct answer is second one. But before that, let's read the third option. The stoma oozes a small amount of blood. It is also normal in a patient with stoma. The stoma does not expel stool. Well, they are asking us during the initial postoperative period, and the stoma, well, it takes around 2 to 4 days to begin functioning. So, what if initial part is not written here? Then the nurse should also report about this to the doctor. But as it is written initial postoperative period, so as the stoma functions after 2 to 4 days, so it is not important. So the correct option is second one. Now moving to the next question. While changing the client's colostomy bag and dressing, the nurse assessed that the client is ready to participate in self-care by noting which of the following. What they are asking us in this question is that what makes the client ready to participate in self-care? Before answering, let's read the options. The client asks what time the doctor will visit that day. No, it is not that important. Second one is the client asks about the supplies used during the dressing change. Well, this indicates that the client may be ready to participate in self-care because he wants to know about the supplies that the nurse is using while dressing. So second one is right so far. But before that, let's read other options. Third one is the client talks about the news on television. No, it just indicates that he wants to avoid the subject of this colostomy bag. Fourth is the client is upset about the way the night nurse changed the dressing. No, this one also indicates that the client is just ignoring the problem. So the correct option is second one. Right. Let's move to the next one. Which of the following skin preparations would be best to apply around the client's colostomy? We all know what is colostomy. We already read about it. So what happens in colostomy is, the opening of the stoma, it is flushed with the skin. Opening of stoma, opening is flushed with skin. As a result, skin excoriation is the most common early complication in patients with colostomy. So we need to protect the skin from getting damage. Okay. So now let's read the options. Stomassive. What is stomassive? Stomacid is used as a filler, right? Stomacid is used as a filler in uneven skin surface to help increase ostomy system wear time and protect the skin to keep the skin healthy. So basically, stomacid is used to protect the skin and to keep it healthy. So it is right option so far. Let's read other options. Petroleum jelly. Petroleum jelly. Then the third one is corn starch, and the fourth one is antiseptic cream. Well, these three options, they do not protect the skin. They do not protect the skin adequately. They protect the skin, but not in that manner, in that amount that we require. They do not protect adequately, and they prevent an adequate seal between the skin and the back. So stomacid is used to apply around the client's colostomy to protect the skin and to keep it healthy. And petroleum jelly, cornstarch, and antiseptic cream, they do not give the protection adequately and they prevent an adequate seal between the skin and the back. So the correct option is option number 1. Now moving to the next question. A client is recovering from an abdominal perineal resection. Which of the following measures would most effectively promote wound healing after the perineal drains have been removed? Well, we all know about the abdominoperineal resection. Let's recall it. What we do in this procedure? We remove the entire anal canal, right? And next one is some part of the sigmoid colon and rectum. Now, what they are asking is measures would most effectively promote wound healing. So, we need to provide most effective measures to promote wound healing after the perineal drains have been removed. Right. Let's go through the options. But before that, what are the factors which promote wound healing? Adequate. The blood supply should be adequate. The blood supply to the wound should be adequate to promote effective wound healing. Next one is keeping the wound clean. Cleanliness of the wound. Keeping the wound infection free. Infection free. So that proper healing could take place. Then adequate oxygenation. It is most important because a few bacteria which thrive in the anaerobic conditions, they get killed during oxygenation. So adequate oxygenation is required. Then avoiding certain drugs like corticosteroids, corticosteroids and cytotoxic drugs. They need to be avoided for proper wound healing. Then other factor is preventing the wound from hypothermia. Prevention from hypothermia. So we need to keep the wound warm for effective wound healing, and also keeping the wound dry so that proper healing could take place. Dry wound. These are the few conditions, few factors which are needed for the wound to heal effectively and quickly. Right, students? Now let's go through the question. Taking SITS path. Now, what we do in SITS path is we can easily wash off the wound, right? So we can clean the wound so that the wound will remain infection free, so that effective healing can take place. So it is a right option so far. Next step is taking daily showers. Well, in case of perineal incisions, it is not a good method to clean the wound, and also it will make the wound wet, which is against our requirement. So second option is not correct. Third one is applying warm, moist dressings to the area. I already told you that we need to keep our wound warm. So we cannot apply moist dressings because it will give space to the bacteria to grow and to delay the wound healing. So this is also wrong. Fourth is applying a protected heating pad to the area. Now, applying this protected heating pad is a good option. But in case if we apply it for more than 20 minutes, it may cause vasodilation, because what basically heating does is heating increases the blood supply. It will cause vasodilation, and it will cause the formation of hematoma, which is totally against effective wound healing. Right, students? So this option is also wrong. So the correct one is taking sits bath. Right. Let's move on to the next question. When planning diet teaching for the client with a colostomy, the nurse should develop a plan that emphasizes which of the following dietary instructions. It's an easy question. Basically, they are asking, when the nurse is teaching the client for the diet, what main factors she should emphasize on. So let's read through the options. Foods containing roughage should not be eaten. Well, roughage is considered as an important source for beneficial bacteria. We are talking about beneficial bacteria. So complete restriction is not required. So this option is wrong. Second one is liquids are best limited to prevent diarrhea. Well, when you are recovering after a surgery, you need to take as much liquids as possible. So drinking liquids is essential as it prevents the client from getting dehydration. Prevents dehydration. So the nurse should encourage the client to drink at least 2 to 3 liters of fluids daily. So this option is Now the third option is the clients should experiment to find the diet that is best for them. Yes, it is the best option so far because it is best to adjust the diet of a client with colostomy in a manner that suits the client best rather than trying special diet. So it should be in favor of the client. So this option is right so far. And about fourth, a high fiber diet will produce a regular passage of stool. Basically, students, what does a high fiber diet will do? It may produce loose stools. Taking adequate fibers in a diet is good, but taking a diet which is rich in high fibers, it may actually produce loose stools. So that's why option 4 is also wrong. So the correct one is option number 3. Now moving to the next question. Which of the following is an expected outcome for a client who is recovering from an abdominal perineal resection with a colostomy? The client will. We all know about the abdominal perineal resection. We already read about it. Now, what is the expected outcome for a client? What will the client will do? So basically, what is the first option? Maintain a fluid intake of 3000 ml per day. I already explained you that fluid is required at least 2 to 3 liters per day so that the patient will not get dehydrated. So option 1 is correct so far. Option second is eliminate fiber from the diet. Eating fibers in the diet in the limited quantity is required because they help improve digestion and can prevent constipation. So that's why we cannot eliminate fibers fully from our diet. So option 2 is wrong. Option 3 is limit physical activity to light exercise. There is no need to limit the exercise fully. The client can resume normal activity as much as the client can tolerate, like basic exercises that he was performing, but up to a limit only. So option 3 is also wrong. Fourth one is accept that sexual activity will be diminished. Yes, the sexual activity will be affected, but there is no need to fully diminish it, right? So this option is also wrong. So the correct one is first one, that is maintain a fluid intake of 3000 ml per day. Now moving to the next question. A client with colon cancer has developed ascites. The nurse should conduct a focused assessment of for which of the following. Select all that apply. Now students, before starting the question, what is ascites? Ascites is accumulation of free fluid into the peritoneal cavity. Accumulation of free fluid in the peritoneal cavity. It is called ascites. It is the first sign of decompensation in the patient. Right, guys? Now, what are the causes for the ascites? There are few causes. Let's talk about them. First one is for portal hypertensive ascites. The main are liver cirrhosis, acute viral hepatitis, alcoholic steatohepatitis, Budd-Chiari syndrome, veno-occlusive disease, IVC thrombosis, portal venous thrombosis. Then for cardiac ascites, we have right heart failure and constrictive pericarditis. For malignant ascites, we have peritoneal carcinomatosis, some massive liver metastasis, malignant lymphoma. For inflammatory ascites, we have TB as an important cause. Then we have bacterial peritonitis, spontaneous bacterial peritonitis, acute pancreatitis. So these are a few of the main causes for different type of ascites that a patient can have. Now back to the previous slide. So what they are asking is the nurse should conduct a focused assessment for which of the following. Select all that apply. The first option is respiratory distress. Well, what happens in ascites is that in ascites, because of the fluid overload in the peritoneal cavity, it limits the movement of the diaphragm, limits the movement of the diaphragm, resulting in respiratory distress. Because the client feels pain, that's why he avoids to breathe, so it leads to respiratory distress. So first option is correct. Second one is bleeding. Bleeding can happen when there is liver enzymes deficiency, or if there is alteration of the liver enzymes which are involved in coagulation, but in this it is not the right option, so bleeding is not correct. Third one is fluid and electrolyte balance. Well, what happens is during ascites there is decreased albumin formation by the liver, decreased albumin formation, so it leads to decreased oncotic pressure, that is decreased pressure in the IVC, intravascular compartment. So we all know that fluid moves from less oncotic pressure to more oncotic pressure. So the fluid moves out and it leads to fluid and electrolyte imbalance. So with first one, third one is also correct. Fourth is weight gain. Well, weight gain is not directly related to ascites, because in ascites malnutrition can occur and it can lead to weight loss. So option 4 is also not correct. Fifth option is infection. There is no risk for infection with the ascitic gland unless proper precautions are not taken during peritoneal tap to remove the fluid. So to remove the fluid from the patient, we do a peritoneal tap, and if proper precautions are not taken during this procedure, it may lead to infection. So infection is also wrong, because infection can only occur during peritoneal tap. So option fifth is also wrong. So the correct ones are only first one and the third one, that is respiratory distress and fluid and electrolyte imbalance. Right? Let's move on to the next question. Done, students. The first one is a client who has had ulcerative colitis for the past 5 years is admitted to the hospital with an exacerbation of the disease, which of the following factors is most likely of greatest significance in causing an exacerbation of ulcerative colitis? Okay, right. So we all know that ulcerative colitis is a type of inflammatory bowel disease, right? And how will the acute exacerbation of the ulcerative colitis will present? It will present with many symptoms. Few of them are bloody diarrhea. One sec. It will present as clinical features are bloody diarrhea, abdominal pain, cramping, rectal bleeding, rectal pain. Then there is urgency to defecate, weight loss, fatigue, and fever. So these are the symptoms with which a patient with ulcerative colitis can present if there is an acute exacerbation, right? Let's get back to the question. So what they are asking is, which of the following factors is most likely of great significance in causing an exacerbation? Right. A demanding and stressful job. Second is changing to a modified vegetarian diet. Third is beginning a weight training program. Fourth one is walking 2 miles, that is 3.2 kilometers every day. Right. Before starting it, I would like to tell you about the severity of the ulcerative colitis. For severity, we can classify ulcerative colitis in four types: mild, moderate, severe, then there is fulminant type. In mild, there is less than 4 stools per day. In moderate, more than 4 stools per day with no systemic signs. That means the client presents with more than 4 stools per day, but there is absence of systemic signs. And in case of severe, in case of severe, we have more than 6 stools per day with systemic signs. The last one is fulminant. It is more than 10 stools per day with toxic megacolon. So this is how we divide ulcerative colitis on the basis of severity. That is mild, moderate, severe, and fulminant. Right. So which of the following factors is most likely of greater significance? First option is a demanding and stressful job. Well, stressful and emotional events, they are clearly linked to the exacerbation of ulcerative colitis, right? So it is a correct option so far because stress disturbs the gut microbiota, disturbs gut microbiota, and also it causes damage to the inner muscular layer, inner muscular layer, which also disturbs the gut microbiota, which in turn leads to chronic inflammation, leading to ulcerative colitis. So yes, stress and emotional events, they are clearly linked to the exacerbation of the ulcerative colitis. So first option is correct so far. Let's go through the other options. Changing to a modified vegetarian diet. No, it has no relation. Beginning a weight training program, it also has no relation with ulcerative colitis. Then walking 2 miles every day, it is also not related. So the correct option is first one. Right. Let's move on to the next question. A client who is experiencing an exacerbation of ulcerative colitis is receiving IV fluids, data to be infused at 125 ml per hour. So they have given us the rate of IV fluid infusion. It is 125 ml per hour. The IV tubing delivers 15 GTT per ml. This is the drip factor. It is 15 GTT per ml. How much should the nurse infuse the fluids in drops per minute to infuse the fluids at the prescribed rate? Well, they have given the rate of infusion in per hour and they're asking us in per minute. So we have to change this hour into minutes, right? So let's solve this MCQ. They have given us that the rate of IV fluid infusion is 125 ml per hour, but we have to convert this hour into minutes. So it will be 125 by 60 ml per minute, right? They have also given us the drip factor for the tube, and it is 15 GT per ml. So what formula we will use? It will be rate of infusion into this drip factor. It will come around 125 by 60 into 15. So it will be around 31 GT per minute, right? So this is our answer. I hope it is clear. The answer is around 31 GT per minute, right? Let's move on to the next one. When planning care for a client with ulcerative colitis who is experiencing an exacerbation of symptoms, which client care activities can the nurse appropriately delegate to an unlicensed assistant? Select all that apply. Right. So we all know about the symptoms which the client faces during exacerbation. And what are these? Bloody diarrhea, abdominal pain, cramping, rectal bleeding, rectal pain, urgency to defecate, weight loss, fatigue, and fever. I have already told you all about these symptoms. So now what they are asking is, which client care activity can the nurse appropriately delegate to the assistant, right? So the first option is assessing the client's bowel sounds. Well, this is not the work of a assistant. It is the job of a registered nurse, so it cannot be delegated to the assistant. So this option is not right. Second one is providing skin care following bowel movements. Yes, nurse can delegate these basic because it is a basic care activity. Providing skin care is a basic care activity. Uh, Basic care activities. Well, guys, the work that a registered nurse does, it basically requires 2 points. First, need of patient, and the second is scope of practice. Right. So in second one, there is no scope of practice. This is just providing regular skin care. So it is the duty of the assistant. So second option is correct. Third is evaluating the client's response to antidiarrheal medications. This is also the job of the registered nurse and not of the assistant. So it can also not be delegated to the assistant. Fourth is maintaining intake and output records. It is the duty of the assistant because there is no hard and fast rule. The assistant just has to keep record of the intake and output. So this also needs to be delegated to the assistant. Fifth one is obtaining the client's weight. This is also delegated to the assistant by the nurse. So out of these five options, second, fourth, and fifth are the activities that the nurse delegate to the unlicensed assistant. Right. Moving on to the next question. Which goal for the client's care should take priority during the first days of hospitalization for an exacerbation of ulcerative colitis? I already told you about the symptoms that the client has during this exacerbation. So let's read the options: promoting self care and independence. But before starting the question, just write the symptoms again: bloody diarrhea, abdominal pain, cramping, rectal bleeding and pain, urgency to defecate, weight loss, fatigue, and fever. Well, diarrhea is the first symptom in an acute exacerbation of the ulcerative colitis, right? And it decreases, and that's why it is the first primary choice to decrease the frequency of stools so that our client do not get dehydrated, right? Diarrhea is the first primary symptom in acute exacerbation of ulcerative colitis, and that's why the primary work of the nurse is to decrease the frequency of stool so that our client doesn't get dehydrated, right? So managing diarrhea is the right option so far. Talking about other options, promoting self-care and independence, maintaining adequate nutrition, promoting rest and comfort. Well, these are the other goals which are ongoing and will be best achieved by halting the exacerbation. But the main aim is to stop the diarrhea first, right? So the best possible answer is second one, that is managing diarrhea. Moving on to the next question. The client with ulcerative colitis is to be on bed rest with bathroom privileges. When evaluating the effectiveness of this level of activity, the nurse should determine if the client has, right, modified bed rest does help conserve energy and promotes comfort, but it is not the primary purpose. So conserving the energy is not the primary purpose. So this option is not correct. Second one is reduced intestinal peristalsis. The primary purpose in this case is to help reduce the hypermobility of the colon, right? What is the primary purpose? What is our primary purpose? Primary purpose is to reduce the hypermobility of colon. Primary purpose is to reduce the hypermobility of colon. In other words, it means to reduce intestinal peristalsis. That's why to reduce the intestinal peristalsis, our client is given bed rest, right? So second option is correct so far. Third one is obtained needed rest. This is not right. Fourth one is minimized stress. Well, remaining on bed rest does not by itself reduce stress. If and if client is having stress, then the nurse can plan with the client to use some strategies to manage the stress. So just by laying on the bed does not help in reducing stress. So fourth option is also not correct. So the correct one is second one, that is reduced intestinal peristalsis. Right. Let's move on to the next one. A client has had an exacerbation of ulcerative colitis with cramping and diarrhea persisting longer than 1 week. The nurse should assess the client for which of the following complications. Right. You already know the symptoms which occurs during exacerbation of ulcerative colitis. I do not need to tell you again. So, what is the primary symptom of ulcerative colitis exacerbation? It is diarrhea, right? So, whenever the client has excessive diarrhea, it results in significant depletion of body stores of sodium and potassium, as well as fluid. So, whenever there is excessive diarrhea, there occurs excessive significant depletion of sodium, potassium, and fluid, right, in our body. So that's why there is need to monitor hypokalemia, right? Hyponatremia and signs of dehydration. So these are monitored, right? Let's read the options. Heart failure, no, it has nothing to do with this. Deep vein thrombosis, no, it is also not related. Hypokalemia, yes, it is a right option. Hypocalcemia, no, calcium has no relation with ulcerative colitis. Right. So the correct option is the third one, that is hypokalemia. Right. Moving on to the next one. A client who has ulcerative colitis says to the nurse, I can't take this anymore. I am constantly in pain and I can't leave my room because I need to stay by the toilet. I don't know how to deal with this. So he needs to stay by the toilet. That means he's having some kind of stomach problem, like a diarrhea or pain something. Based on these comments, the nurse should determine the client is experiencing okay. Let's read the options. Extreme fatigue, disturbed thought, a sense of isolation, difficulty coping. Right. Extreme fatigue. The client has not expressed any sign of extreme fatigue, right? Because he's not saying that he's tired and he cannot, and that's why he can't move. He just said that he needs to stay by the toilet. So this option is wrong. He has also not expressed any sign of disturbed thought. So this is also wrong. A sense of isolation. No, this is also wrong. Well, fourth option is difficulty coping. It is common for the client with ulcerative colitis to become apprehensive and have difficulty coping with frequency of stools and presence of abdominal cramping. So, a client with ulcerative colitis during in case of flare-ups, he can have difficulty coping with frequency of stools because we all know that the main symptom is bloody diarrhea, right? So, the patient can have difficulty with frequency of stools and abdominal cramping. During these acute exacerbation, client need emotional support and encouragement so that the client can share his feelings with the nurse or with the doctor or with his family members. So he has difficulty in coping, right? So the correct option is fourth one. Right. Let's move on to the next one. A client newly diagnosed with ulcerative colitis who has been placed on steroids asks the nurse why steroids are prescribed. The nurse should tell the client, well, what is the role of steroids in case of ulcerative colitis? We all know that the first line of drug for the treatment of ulcerative colitis is 5-ASA derivatives. And the perfect example is sulfasalazine. Right? So first line derivative is sulfasalazine. In case if it is not working, or in case of acute exacerbation, for acute exacerbation, we start using steroids because steroids help by quickly reducing inflammation in the digestive tract, right? So how does steroid help? They are by quickly reducing inflammation in the digestive tract. So that's why they are used to suppress the flare-ups, that is, in case of acute exacerbation, right? And in case if there is no response to steroid, if no response to steroids, or we can say if there occurs complications of steroids, then we move towards surgery. And what is the surgery for ulcerative colitis? It is total proctocolectomy. Total proctocolectomy is done with ileoanal pouch anastomosis, right? So this surgery, that is total proctocolectomy with ileoanal pouch anastomosis, is done for complete elimination of the ulcerative colitis. So this is how we treat the ulcerative colitis. Now moving back to what they are asking us in the question, what should the nurse tell the client about the use of steroids? First one is, ulcerative colitis can be cured by the use of steroids. No, we use steroids only in case of acute exacerbations. So and also ulcerative colitis is a chronic disease. So steroids can't cure it. They are just used in case of acute exacerbation, only for acute attacks, acute exacerbation. So first option is not correct. Second one is, steroids are used in severe flare-ups because they can decrease the incidence of bleeding. This option is correct because I told you that steroids are used for acute exacerbations. So that's what they are written here, right? Steroids are effective in acute management of acute symptoms of ulcerative colitis, right? So second option is correct so far. Third one is, long-term use of steroids will prolong periods of remission. Well, there are two ways to give steroids. Let me tell you. When we give steroids, there are two types of therapies. One is short-term therapy, the other one is long-term therapy, right? If we give long-term therapy, it is not beneficial because it can lead to complications, or we can say there can occur side effects of using steroids, side effect of steroids, right? So that's why we do not give long-term therapy, but we give short-term therapy whenever there is acute exacerbation of the disease, right? So short-term steroid therapy is used in case of management of acute exacerbation of the disease, right? So let's read the third option again. Long-term use of steroids will prolong periods of remission. No, long-term use of steroids is not effective in prolonging the remission because of the side effects indicated, right? So third option is also wrong. Fourth one is, the side effects of steroids outweigh their benefits to client with ulcerative colitis. Now, what are the side effects of using steroids? The various side effects are, the client gains some weight, so there is weight gain, there is acne, moon phase, insomnia, that is not able to sleep at night, increased risk of osteoporosis because of decreased mineral density of the bones, increased BP, increased blood sugar levels, right? So these are the few side effects of long-term use of steroids. So client should be assessed carefully for these side effects. But if the client take short-term therapy, then the benefits of this short-term therapy outweighs these side effects. So that's why this statement is wrong that the side effects of steroids outweigh their benefits. No, the benefits of using short-term steroid therapy outweighs these side effects. So fourth one is wrong, right? This statement can only be true in case if it is written that the side effects of long-term steroid outweighs their benefits. But the benefits of using short-term steroid therapy outweighs the side effects of steroids, right? So fourth is also wrong. So the correct one is just second option, that is steroids are used in severe flare-ups because they can decrease the incidence of bleeding, right? Now let's move on to the next one. A client who has ulcerative colitis, has persistent diarrhea, and has lost 12 lbs, that is 5.4 kgs, since the exacerbation of the disease, right? For which of the following will be the most effective in helping the client meet nutritional needs, right? So our client has ulcerative colitis. It is a type of inflammatory bowel disease. We already know what are the acute exacerbation symptoms, right? We already know about the symptoms. Let's recite them once again so that you never forget them. Bloody diarrhea, abdominal pain, cramping, bleeding, rectal bleeding, weight loss, fatigue, fever, and urgency to defecate. Right. So, what is our main priority? Our main priority is to rest the bowel of the patient. So, what is main priority? Main priority is rest the patient's bowel. Right. Now, how we can rest the patient's bowel? It is by withholding the food, that is food will be withheld from the client, but we also need to maintain the client's nutritional status, right? So we have to keep his nutritional status in mind, withheld food but maintaining nutrition. So this is our strategy to rest the patient's bowel by withholding food but maintaining nutrition. And how we will do that? By starting TPN. TPN is total parenteral nutrition, right? TPN is total parenteral nutrition. Now, if we talk about the first option, that is continuous enteral feedings, it does not allow the bowel to rest. If we will keep giving these enteral feedings continuously to our patient, then the patient's bowel will not be able to rest. So, first option is incorrect. Second one is following a high calorie, high protein diet. No, this is also not correct. Fourth is eating 6 small meals a day. Dividing the diets does not allow the bowel to rest. So it is also not correct. So the correct option is the third one, that is total parenteral nutrition. Right. Let's move on to our next question. A client with ulcerative colitis is to take sulfasalazine, right? It is the primary treatment for a patient with ulcerative colitis. It is a type of 5-ASA derivatives, right? Which of the following instructions should the nurse provide for the client about taking this medication at home? Select all that apply. Right. Let's start the question. What is sulfasalazine? What is sulfasalazine? Sulfasalazine is a type of amino salicylate. It impairs folic acid absorption and metabolism, so leading to folic acid deficiency. It also causes dizziness in the client, right? Now, other than treating ulcerative colitis, it can also be used to treat which other disease? Rheumatoid arthritis, right? So it can also be an important exam question, right? These all are important points, just do not forget them, right? Now moving back to our question, let's read the options. Number one is drink enough fluids to maintain a urine output of at least 1200 to 1500 ml per day, right? The fluid intake in the client should be sufficient to prevent crystalluria and stone formation. So that's why, to prevent crystalluria and stone formation. So first option is correct. Now read the second one. Discontinue therapy if symptoms of acute intolerance develop and notify the healthcare provider. Right. What are the, before starting, what are the symptoms of acute intolerance? The symptoms are, I will write it here: cramping, acute abdominal pain, then we have bloody diarrhea, fever, headache, and rash. So these are the symptoms of acute intolerance, right? So if these symptoms persist, then the client has to discontinue the therapy and he should notify the healthcare provider. So second option is also correct. Stop taking the medication if the urine turns orange yellow, right? Well, yes, the nurse can inform the client that this medication can cause orange yellow discoloration of urine and the skin, but there is no need to stop the medication, right? Yes, this medication can cause orange yellow discoloration of the urine and the skin. The nurse will tell this to the client, but there is no need to stop the medication. So that's why this option is wrong. because there is no need to stop, but yes, the nurse can inform the client about this side effect of the using this drug, right? The third option is not correct. Fourth is avoid activities that require alertness. As I already told you that sulfasalazine causes dizziness. So the nurse should question the client to avoid driving or any other activities that require alertness. So this option is also correct. Fifth one is if dose is missed, skip and continue with the next dose. Well, if a client misses a dose, he can take it as soon as it he remembers it, unless it is almost the time for the next dose. Are you getting it? If he misses the dose, he can take it as soon as he remembers it. But if it is the next time of the dose, then he should just take the next dose and leave the forget one, right? So fifth one is wrong. So the correct options are the first one, the second one, and the fourth one. It is a good question. Try to summarize most of the points, right? Let's move on to our next question, and it is the physician prescribes sulfasalazine for the client with ulcerative colitis. It is the same drug, right? Which instruction should the nurse give the client about taking this medication? Right. So, sulfasalazine, it is a first line treatment for ulcerative colitis. It is a 5-ASA derivative. It is a amino salicylate. It is also used to treat rheumatoid arthritis, right? It impairs with folic acid absorption and metabolism. That's why causing folic acid deficiency. That is why we need to keep in mind that we have to fulfill our diet's folic acid need, right? So these are the few points which I already mentioned. You just need to learn them, right? So what they are asking is what instruction should the nurse give the client about taking this medication, right? Let's go through the options first. Avoid taking it with food. Take the total dose at bedtime. Take it with a full glass of water. Stop taking it if urine turns orange yellow, right? Well, this sulfasalazine can cause gastrointestinal distress, right? This drug can cause gastrointestinal distress. That's why the client should take this drug after meals. So first option is avoid taking it with food. So it is a wrong option. It must be taken with food to avoid gastrointestinal distress, right? So this is wrong. Next one is take the total dose at bedtime. Well, the doses are taken in equally divided doses, right? We cannot take the total dose whole dose at one time. So this is also a wrong option. Third is take it with a full glass of water. Now this option is correct so far because adequate fluid intake of at least 8 glasses a day is required to prevent crystalluria and stone formation. So third option is correct so far. Fourth one is stop taking it if urine turns orange yellow. I already told you that it is a side effect of using sulfasalazine that the color of the urine and color of the skin turns orange yellow. The nurse should tell this to the patient, but there is no need to stop the medication. So that's why fourth option is wrong. So the correct one, the best possible answer is third one, that is take it with the full glass, that is 240 ml of water, right? Moving on to the next question. The nurse has a prescription to administer sulfasalazine and it is 2 gram. The medication is available in 500 milligram tablets, right? How many tablets should the nurse administer? So they are just asking us about the number of tablets. Now it's a very easy question. Total dose is 2 gram, that is 2000 milligram. One tablet dose is 500 milligram. So number of tablets that the nurse should administer is 2000 by 500, and that will equal to 4. So the correct answer is 4 tablets, right? Right. Now move on to the next question. Which of the following diets would be most appropriate for the client with ulcerative colitis? Right. So basically they are asking about the most appropriate diet for the client with ulcerative colitis. Right. The client with ulcerative colitis should have a diet rich in high calories, high protein, low residue, or we can say low fiber, low fat, right? Why high protein? Because protein is required for tissue healing. For tissue healing, that's why the client requires high protein diet. So this is correct. This is correct. The client should avoid high residue diet. Why? Avoid high residue diet. What are the food products, food sources which contains high residue? They are whole wheat grains, nuts, veggies, and raw fruits. So the clients should avoid high residue diet and should take low residue or low fiber diet and low fat. Why low fat? Because in ulcerative colitis the tendency for fat metabolism decreases. That's why the client needs to have low fat in his diet, right? So let's go through the option. High calorie, low protein. No, this one is wrong. High protein, low residue. This one is correct so far. Low fat, high fiber. No, this is wrong. Low sodium, high carb. Well, it has the it has nothing to do with sodium diet. No need to follow low sodium diet. So this one is also not correct. So the correct option is high protein, low residue diet. That is second one. Right. Let's move on to our next question. A client who has a history of Crohn's disease is admitted to the hospital with fever, diarrhea, cramping, abdominal pain, and weight loss. Right? The nurse should monitor the client for. It's a similar question that we did earlier. It is Crohn's disease. It is also a type of inflammatory bowel disease, right? What are the clinical features with which the clients present? They are a patient having Crohn's disease mimics acute appendicitis, right? And he, he can have abdominal pain, diarrhea, aphthous ulcers, radiologically we can see a sign. What is the name of the sign? String sign of Cantor. String sign of Cantor. Then we have a marker for Crohn's disease, and it is stool calprotectin, right? So these are the important points related to Crohn's disease. These are the few clinical features. Then this is how radiologically we see Crohn's disease, and this is the marker for Crohn's disease, that is stool calprotectin, right? Now let's get back to our question. What should the nurse monitor in client, right? The first option is hyperalbuminemia. Hyperalbuminemia, right? In Crohn's disease, the client with Crohn's disease presents with malnutrition and protein losing enteropathy, right? Our client can have malnutrition and protein losing enteropathy, which results in hypoalbuminemia. So not hyper, but hypo. So first option is wrong. Second one is thrombocytopenia. Well, our client can have anemia. Now, what type of anemia can the client have in case of Crohn's disease? Two types of anemia: anemia of chronic disease and iron deficiency anemia, right? And with anemia, there occurs thrombocytosis, right? So, thrombocytopenia doesn't occur, but there occurs thrombocytosis and anemia. So, second option is also incorrect. Third one is hypokalemia. Well, I already told you that this patient can present with diarrhea. So, in case of diarrhea, there occurs loss of sodium, potassium, and fluids from the significant loss actually from our body stores. As a result, our client can present with hypokalemia, hyponatremia, and dehydration. So, the nurse should monitor our client for these signs. So, hypokalemia is correct so far, and also because of the low potassium levels in the body, our client is at greater risk for, let me clear the screen, greater risk of cardiac arrest. Fourth option is hypercalcemia. Calcium levels are not affected, right? Calcium levels are not affected. So it is also wrong. So the correct answer for the for this question is third one, that is hypokalemia, right? So this is the end of our session. Thank you very much. Goodbye. The first question is: a client with Crohn's disease has concentrated urine decreased urinary output, dry skin with decreased turgor, hypotension, and weak thready pulses. The nurse should do which of the following first? Right. So the given signs, what are these? What they indicate? They indicate dehydration in our patient. Right. So these are basically the signs of dehydration. So our client who has Crohn's disease is now having dehydration as a complication, right? So what is the duty of the nurse? So now have a look at the options. Encourage the client to drink at least 1000 ml per day. Okay. No, our client has to drink more than 1 liter per day, so it's not the right option. Second one is provide parenteral rehydration therapy prescribed by the physician. Yes, it is a necessary thing to combat dehydration. To combat dehydration, our client has to be provided parenteral rehydration therapy. So second one is correct so far. Third one is turn and reposition every 2 hours. Well, it is a good thing because it helps in the prevention of skin breakdown. But our first requirement is to hydrate our patient. So note the best choice. Fourth one is monitor vital signs every shift. Yes, it is also important to monitor the signs, but as I told you, our first priority is to rehydrate our patient. So also note the best choice. So out of the four options, the correct one is the second one. Right. So now moving on to the next question. The nurse is developing a plan of care for a client with Crohn's disease who is receiving TPN, that is total parenteral nutrition. Which of the following interventions should the nurse include? Select all that apply. Yes. So to answer this kind of question, we need to go through the options first, right? First is monitoring vital signs once a shift. Well, the nurse should monitor the vital signs every 4 hours so that we can detect the early complications, right? So not once a shift but every 4 hours. So not correct. Second is weighing the client daily, right? So it is very important to weigh our client. Why? Because it is important for monitoring of renal status, right? For monitoring renal status, it is important to weigh our client, right? Now, what other things we can do to monitor renal status other than this weighing our client? Other things that we can do are we can maintain intake output ratio from the urine bag. Number one thing. Number second that we can do is measuring serum creatinine and blood urine nitrogen. Right. So these are the three things that we can do for monitoring renal status. Number one, weighing our client daily. Second is intake and output ratio. Third is measuring serum creatinine and blood urea nitrogen. So second option is correct. Third one is changing the central venous line dressing daily. Now it is not changed daily. It can be changed once or twice a week, right? Or whenever if the line becomes soiled or loose or wet. So there is no need to change the line daily. So third option is also not correct. Fourth one is monitoring the IV infusion rate early. Yes, it's important to keep a track. So fourth option is also correct. Fifth one is taping all IV tubing connections securely. Yes, it is important to prevent any type of disconnections, right? So fifth one is also correct. So out of the five options, the correct ones are second one, fourth one, and fifth one. Right. So now let's move on to our next question. Which of the following should be a priority focus of care for a client experiencing an exacerbation of Crohn's disease? Right. So now our client is having an attack of Crohn's disease, like that is an exacerbation of Crohn's disease. So what should be our priority? Our priority goal is to promote bowel rest. Our priority is to promote bowel rest, and why? So that intestine can get a chance to heal properly, right? So our priority is to promote the bowel rest in our client so that the intestine of the client can get a chance to heal properly. So this is our priority goal. Now looking at the options, encouraging regular ambulation. Well, it is important to encourage regular ambulation, but our priority is resting the bowel. So not important. Second one is promoting bowel rest. Second is correct, right? Now, how we accomplish this promoting bowel rest? How it is done? It is accomplished through decreasing our client's activity, right? Encouraging the client to rest. And third is placing our client on nothing by mouth diet, right? But one thing that we have to keep in our mind is maintaining his nutritional status. Maintain nutritional status, and it is done parentally, right? So this is how we promote bowel rest by decreasing activity, encouraging rest, and putting our client on nothing by mouth status, but maintaining his nutritional status parentally, right? So second option is correct so far. Third one is maintaining current weight. Yes, it is important, but our client will surely lose some weight because it's an illness. So third option is also not correct. Fourth one is decreasing episodes of rectal bleeding. This is one important point in Crohn's disease, that whenever that the diarrhea that is associated with Crohn's disease is non-bloody. The patient having Crohn's disease always presents with non-bloody diarrhea. So it's a good differentiating feature, right? So non-bloody diarrhea and rare episode of rectal bleeding, right? So these episodes of rectal bleeding are so rare that they are not even expected. So fourth option is also wrong. So the correct one is second one, that is promoting bowel rest, and it is our main priority so that the intestine of our client can get a chance to heal. Right. So moving on to our next question. A nurse is assessing a client who has been admitted with a diagnosis of an obstruction in the small intestine. The nurse should assess the client for which of the following. Select all that apply. Right. So basically, they are asking us the symptoms with which the client will present in case of having obstruction of small intestine. Right. So quickly moving on. So the client having obstruction in small intestine will present with projectile vomiting, rapid dehydration, electrolyte imbalance because of the fluid loss. Next is increasing bowel sounds. Now, why this bowel sounds increase? See, if this is an intestine, small intestine, this is small intestine, right? And this is obstruction. This is the proximal segment. This is the distal segment. So, this proximal segment contracts so vigorously so that it tries to overcome this obstruction, right? So, this vigorous contraction is perceived as hyperperistaltic bowel sound. So, that's why our client presents with increased bowel sounds. So, these are the few features with which our client who has obstruction in the small intestine presents, and these are projectile vomiting, rapid dehydration, electrolyte imbalance, and increased bowel sounds. Right. Also, there will be no diarrhea. And about abdominal distension, it will be minimal. Right. So, no diarrhea, minimal abdominal distension. And about the abdominal pain, it will be intermittent. And as I told you that there is projectile vomiting, so this abdominal pain which is intermittent, it is relieved after vomiting. Right. So now let's look at the options. Projectile vomiting, yes, it's correct. Second is significant abdominal distension. No, the abdominal distension is minimal, so not right. Third is copious diarrhea. There is no diarrhea, so not right. Fourth is rapid onset of dehydration. Yes, it is correct. Fifth one is increased bowel sounds. Yes, as I already told you that the proximal bowel contracts vigorously to overcome the obstruction in the small intestine. So it is perceived as hyperperistaltic bowel sound. So out of the five options, the correct one are first, fourth, and fifth. Now talking about if the client has large intestine obstruction, then what are the clinical features? Please note them. The pain will be persistent. In small intestine, it was intermittent, right? But here it is persistent pain. And this large intestine obstruction, it evolves slowly, right? So usually evolves slowly. The small intestine obstruction was rapid, but it evolves slowly, right? And um, here we have vomiting, which is very rare. So not very common. But in small intestine obstruction, it was projectile. And our client could also have obstipation. Obstipation. Kindly note, it's not constipation, it's obstipation. And what is obstipation? It is non-passage of flatus or feces. Non-passage of flatus or feces is obstipation, right? And last is abdominal distension, which is minimal in case of small intestine obstruction, but in large intestine it is significant. So these are the few clinical features that differentiates this large intestine obstruction from the small intestine obstruction, right? So now moving on to the next question. A client is admitted with a bowel obstruction. The client has nausea, vomiting and crampy abdominal pain. The physician has written the following prescriptions for the client to be up ad lib, have narcotics for pain, and have a nasogastric tube inserted if needed, and for IV Ringer's lactate and hyperalimentation fluids. The nurse should do the following in order of priority from first to last. Right. So to answer this kind of question, we have to go through the options first, and they are asking about the order of priority, right, in which the nurse should act. Okay. So in this scenario, you have to think like a nurse. So the nurse should first help the client ambulate to promote peristalsis, right? So because it will be an effective procedure for the client, and it requires least amount of invasive, right? It is effective step, and also least invasive procedure. So the nurse should assist with ambulation to promote peristalsis. It is the first priority. Second is, after this, the nurse should initiate IV fluid therapy to correct the fluid and electrolyte imbalance in the client using ringer lactate. So this is the next priority. After that, the nasogastric tube is inserted to reduce gastric secretions. So this is the third priority. And at last, hyperalimentation fluids are given. Now, why these fluids are given? Because they can be used to correct protein deficiency from chronic obstruction, paralytic ileus, or an infection. Right. So the correct priority order is, first the nurse has to assist the client with ambulation to promote peristalsis because it's an effective procedure and it is the least invasive procedure. So first is this. After that, the nurse has to administer IV Ringer's lactate to correct fluid and electrolyte imbalance in the client. After that, the nurse has to insert a nasogastric tube to reduce gastric secretion, to reduce gastric secretion. After that, the last is starting an infusion of hyperalimentation fluids to correct protein deficiency. Right. So moving on to the next question. The physician prescribes intestinal decompression with a Cantor tube for a client with an intestinal obstruction. In order to determine effectiveness of the intestinal decompression, the nurse should evaluate the client to determine if. Right. So before starting the question, what is Cantor tube? Cantor tube is basically a 6 to 10 foot, that is 180 to 300 centimeter tube, which is passed in into the small intestine up to the obstruction. Right. It is a 180 to 300 centimeter tube and passed into small intestine to the obstruction. Now, why is it passed? Right. It is passed to remove any accumulated fluid and gas due to the obstruction to relieve the pressure. Right. So the main purpose of passing this Cantor tube inside the small intestine of the client is to remove any accumulated fluid and gas so that the pressure can be relieved. So the first option is intestinal fluid and gas have been removed. So it is a right option. Second one is the client has had a bowel movement. Well, the client cannot have any adequate bowel movement until the obstruction is removed. So this is not right. Third is the client's urinary output is adequate. Pressure from the distended intestine should not obstruct the urinary output. So it has no relation with the urinary output. So not significant. Fourth is the client can sit up without pain. Yes, the client may be able to sit up and maybe the pain will be less, but it has no relation with this. So not correct. So the correct option is the first one, that is intestinal fluid and gas have been removed. Right. So moving on to the next question. After insertion of a nasoenteric tube, the nurse should place the client in which position? Right. Now, why is it important to insert the tube? First of all, why is it important to insert the tube? It is important to reduce gastric secretion. Students, kindly note it down. To remove any accumulated fluid or gas to relieve the pressure. Right. So this is the reason why nasoenteric tube is inserted. And now placing the client in appropriate position is necessary to facilitate the progression of the tube inside the intestine, right? So perfect position is very necessary to facilitate the tube progression. So let's read the options. Supine, second is right side lying position, third is semi-fowler's position, fourth is upright in a bedside chair. Right. In this second one, which is right side lying position, this is the correct answer, students. And why? Because to facilitate the movement of the tube through the pyloric sphincter, this right side lying position is necessary to facilitate the movement through pyloric sphincter, we need our client to lie down in this right side lying position to facilitate through pyloric sphincter. This is necessary. And after the tube will enter inside the intestine, the client is turned from side to side, or we can encourage him to ambulate so that to facilitate the tube movement through the intestinal loops, which is not possible in these positions, that is supine, semi-fowlers, and sitting in a bedside chair. Right. So the correct option is the second one, that is right side lying position. Right. So now let's move on to the next question. The nurse preparing a client for insertion of a nasoduodenal tube should teach which of the following? Select all that apply. Right. This is a nasoduodenal tube, and why is it used? It is used primarily for feeding, and it is inserted in endoscopy or radiology. Right. Now, what are the cases in which we cannot use this nasoduodenal tube? That is, what are the contraindications? Contraindications are coagulopathy, sinusitis, head trauma, esophageal strictures, or any surgery, or deviated nasal septum. So these are the few conditions in which we cannot use this nasoduodenal tube, right? So now let's read the options. The nose and throat will be numbed with a viscous anesthetic. Yes, a viscous xylocaine is used. So this option is correct. Second is the tube will be placed at the bedside. No, we should not place the tube at bedside because we have to maintain the aseptic conditions, right? So not a good point. Third is X-rays with the use of a contrast dye will be used to verify placement. Yes, third option is correct. Fourth is the client will be closely monitored for 30 minutes following the procedure. Yes, it is necessary to monitor our client for at least 30 minutes to make sure that the client does not have any allergic reaction through the tube, or to look for in case if any injury happened to the lung, or in case of any bleeding. So it is very necessary to monitor our client for at least 30 minutes. Fifth is the tube will be taped to the nose. Yes, to prevent it from getting disconnected. Right. So the correct options are first one, third one, fourth one, and the fifth one. Right. So now let's move on to the next question. The client with an intestinal obstruction continues to have acute pain even though the nasoenteric tube is patent and draining. Which action by the nurse would be most appropriate? Right. So students, it's an easy question, right? To answer this question, we have to first go through all the points. First is reassuring the client that the nasoenteric tube is functioning. Well, reassuring the client is important, but before reassuring, it is important for the nurse to accurately assess the point, right? So the priority is to assess the client before reassuring. So not a better option. Second is assess the client for a rigid abdomen, right? Assessing the client is very necessary, right? And why is it so? Because the pain that the client is complaining of, it may be indicative of peritonitis, right? So the nurse should assess the client for signs and symptoms of peritonitis. And what are the signs and symptoms? They are rigid abdomen, elevated temperature of the client, and increased pain. Right. Third option is administer an opioid as prescribed. Well, before employing any pain relief measures, it is important to assess the client. So, not correct. Fourth is repositioning the client on the left side. It will not resolve the pain. So, not important. So, the correct option is the second one, that is assessing the client for a rigid abdomen, right? So, now let's move on to the final question of the day. The nurse is teaching the client how to care for an ileostomy. The client asks the nurse how long to wear the pouch before changing it. The nurse should tell the client which of the following. Right. So, what is ileostomy? Ileostomy is basically opening of the ileum onto the abdominal wall. Right. Opening of ileum onto the abdominal wall is ileostomy. Right. And the key features of an ileostomy are it has a higher output, and in the output is more liquid in nature, and as it is higher output, so there is more chances of fluid and electrolyte imbalance, right? Due to higher output, increased risk of skin excoriation, right? So these are the features of an ileostomy, that is higher output, more liquid in nature, more fluid and electrolyte imbalance, increased risk of skin excoriation, right? So now what they are asking is the nurse should tell the client which of the following, right? About the changing of the pouch. So the pouch is changed only when it leaks, right? Well, it is correct that the pouch is changed when it leaks, but it is changed not only when it leaks, right? Are you getting it? The pouch is changed when it leaks. It is a correct statement, but this only is not right here, because we can also change the pouch after 4 to 7 days. We need to change the pouch after 4 to 7 days, right? So this is not the only time when we need to change the pouch, right? So we can change our pouch during leakage and after 4 to 7 days. So both are the correct options. So as it is written only here, so this option is wrong. Next is you can wear the pouch for about 4 to 7 days. Yes, as I already told you that we have to change the pouch after 4 to 7 days, so we can wear it for about 4 to 7 days, right? So this option is correct. Next one is you should change the pouch every evening before bedtime. It is not necessary to change the pouch every evening, right? So not correct. It depends on your activity level and your diet. Well, the diet and the activity level doesn't affect the schedule of changing the pouch, so not important. So the correct option is the second one, that is you can wear the pouch for about 4 to 7 days, right? So thank you. The first question for the today's date is: a client is scheduled for an ileostomy. Which of the following interventions would be most helpful in preparing the client psychologically for the surgery? Right. So there is a client who is scheduled for the surgery, and what is the job of the nurse, which will be helpful for the client psychologically. Okay, so let's go through the options. Include family members in pre-operative teaching sessions. Well, it is beneficial, but it does not focus on client psychological preparation, so not the correct one. Second is encourage the client to ask questions about managing an ileostomy, right? So it may be rushing the client psychologically into accepting the change in his body image and functioning. The client may need time to first handle the stress of surgery and then observe the care of ileostomy by others, right? So, not a correct option. Third is provide a brief, thorough explanation of all pre-operative and post-operative procedures. This option is correct because it helps the client prepare and understand what to expect, right? It also provides an opportunity for the client to share his concerns. So this option is correct so far. Fourth one is invite a member of the ostomy association to visit the client. It is not important. So out of the four options, the correct one is the third one. That is providing a brief thorough explanation of all preoperative and postoperative procedures to the client. Right. So moving on to the next question. The nurse should instruct a client who is scheduled for an ileostomy to do which of the following 2 weeks before surgery. So, what should the nurse instruct the client during the preoperative period? Right. So, this is the question. First is stop taking drugs that will interfere with clotting. That is aspirin and ibuprofen. Right. So, they are anticoagulants. Right. So, this is the correct option because it prevents the risk of preoperative bleeding. That's why the nurse should instruct the client to stop taking these drugs. Second is follow a low residue diet. Well, the client should take a high fiber diet, a high residue diet with increased fluids during this preoperative period. So this option is wrong. Abstain from having sex. It is not necessary. Wear a mask when in public to prevent infection. It is right, but this is not the nurse will instruct to the client, right? And also the client should the nurse should report any infection during this preoperative period to the healthcare provider, right? So the correct option is the first one, that is stop taking drugs that will interfere with clotting, aspirin and ibuprofen, right? So moving on to the next question. Immediately after having surgery to create an ileostomy, which goal has the highest priority, right? So, which goal has the highest priority? Well, before starting the question, let's first read what are the post-operative complications of ileostomy. And these are fluid and electrolyte imbalance. Next one is skin excoriation. Next one is prolapse of the stoma. Next is retraction. Next is necrosis and parastomal herniation, right? So these are few of the post-operative complications that the client can have post ileostomy, right? So now going through the options. Providing relief from constipation. Well, the client will experience continuous liquid to semi-liquid stools and there will be no case of constipation, so this option is not correct. Next one is assisting the client with self-care activities. That's not a priority. Maintaining fluid and electrolyte imbalance. As I already mentioned that this fluid and electrolyte imbalance is one of the major complications that the client can experience during the postoperative period. So this option is correct. Last one is minimizing odor formation. It totally depends on the diet and it's not a priority here. So not a correct one. So out of the four options, the correct option is the third one, that is maintaining fluid and electrolyte balance. Right. Moving on to the next question. The client asked the nurse, is it really possible to lead a normal life with an ileostomy? So here the client is having concerns regarding this surgery. Which action by the nurse would be the most effective to address this situation? Well, before answering the correct option, let's go through options. First is have the client talk with a member of the clergy about these concerns. Right. Second option is tell the client to worry about those concerns after surgery. Third is arrange for a person with an ostomy to visit the client preoperatively. Fourth is notify the surgeon of the client's question. Right. So first is having the client talk with a member of the clergy about these concerns. Well, a visit from the clergy may be helpful to some client, but it would not provide this client with the information sought, right? So it will not solve his concerns. So this option is not correct. Tell the client to worry about those concerns after surgery. No, it is not helpful. It is just ignoring the client's concerns. So not correct. Third is arrange for a person with an ostomy to visit the client preoperatively. It would be the most helpful measure. This would let the client actually see how to adjust in life after the surgery. Someone who has felt same concerns can answer the client's concerns, right? So this option is correct. Next is notify the surgeon of the client's question. Well, it is helpful, but there is nothing that the surgeon can do, right? And it will not help the client with his concerns. So this option is also not right. So the correct option is the third one, right? Let's move on to the next part. 3 weeks after the client has had an ileostomy, the nurse is following up with instruction about using a skin barrier around the stoma at all times. The client has been applying the skin barrier correctly when, right? So why is the skin barrier is used after the procedure? Why? Because of high concentration of the digestive enzymes, ileostomy effluent is irritating the skin and it can cause skin excoriation and ulceration. This part I already told you when I told you the postoperative complications. So this is one of the complication, that is skin excoriation and ulceration, right? So to prevent this, we have to apply the skin barrier, right? So that's why some form of protection must be used to keep this effluent from contacting the skin, right? Now let's read the options. There is no odor from the stoma. Well, it does not depend on the skin barrier. Skin barrier does not decrease the odor formation. Odor is completely controlled by the diet that the client is taking. So this option is not right. Second one is the client is adequately hydrated. Right. It has no relation with the this ileostomy. Right. The nurse can encourage the client to have an adequate daily intake of fluids, but it has no relation with the skin barrier. So not correct. Third is there is no skin irritation around the stoma. This option is correct because if barrier is correctly applied, there will be no skin irritation around the stoma. So this option is correct. The last one is the client only changes the ostomy pouch once a day. No, it is not necessary to change the pouch every day. It should be changed after 4 or 7 days, right? It will save the resources that the client can have, right? So the correct option is the third one, right? Let's move on to the next question. The nurse should instruct the client with an ileostomy to report which of the following immediately, right? The first option is passage of liquid stool from the stomach. It is quite normal to pass liquid stools because I already told you that the client can pass liquid to semi-liquid stools, right? So this option is quite normal. So it is not the answer. Second is occasional presence of undigested food in the effluent. Undigested food may be present at some point of time, so not a thing for concern. Absence of drainage from the ileostomy for 6 or more hours. Right. So this is the correct option because any sudden decrease in drainage or onset of severe abdominal pain should be reported to the physician immediately because it could mean that an obstruction has developed, right? So it should be reported immediately. Fourth is temperature of 99.8 degree Fahrenheit, that is 37.7 degrees Celsius. It is also not abnormal or it is not a cause for concern. So the correct option is the third one, right? Let's move on to the next part. Wait. The nurse finds the client who has had an ileostomy crying. The client explains to the nurse, I am upset because I know I won't be able to have children now that I have an ileostomy. Right. Which of the following would be the best response for the nurse? Right. So our client is upset and he's telling the nurse that I won't be able to have children. So this is his concern, right? So what is the duty of the nurse in such scenario? Well, let's go through the options first. Many women with ileostomies decide to adopt. Why don't you consider that option, right? So the nurse is telling the client to adopt, right? So empathizing or telling the woman that she can adopt, it does not address her concerns, right? So this option is not correct. Next one is having an ileostomy does not necessarily mean that you can't bear children. Let's talk about your concerns, right? So this is the correct option so far, right? Well, after having ileostomy, it is recommended that the number of pregnancies will be limited, right? But it is not written anywhere that you can't have children. So, women of childbearing age should be encouraged to discuss their concerns with their physician, right? So, this second option is correct. Third one is I can understand your reasons for being upset. Having children must be important to you, right? This option is also not correct because it does not address the client's concern, right? The fourth one is I'm sure you will adjust to the situation with time. Try not to be upset. Okay, so telling the client to adjust, just just means ignoring her concerns, right? So this is also the wrong option. So out of the four options, the correct one is the second one, that is having an ileostomy does not necessarily mean that you can't bear children. Let's talk about your concerns, right? Let's move on to the next question. Which of the following statements about ileostomy care indicates that the client understands the discharge instruction? Right. So Let's go through the options first. I should be able to resume weightlifting in 2 weeks. Well, the lifting should be avoided, right? And the physician will indicate the client when to start the lifting again. So before that, the client should not lift heavy weights. So first option is wrong. Second one is I can return to work in 2 weeks. No, it is not advised to return to the work just in 2 weeks. So not correct. I need to drink at least 3000 ml a day of fluid. Right. So to maintain an adequate fluid balance, the client will be advised to drink at least 3 liters of fluid. Right. And you already know that fluid and electrolyte imbalance is one of the major complications that a client can have post operatively. So this option is correct. Fourth is I will need to avoid getting my stomach wet while bathing. Right. So water does not harm the stomach, so there is nothing to worry about. Right. So this option is also not correct. So the correct one is the third one, that is to drink at least 3 liters a day of fluid. Right. Moving on to the next question. A client with a well-managed ileostomy has sudden onset of abdominal cramps, vomiting, and watery discharge from the ileostomy. The nurse should. Okay, so here the client who underwent ileostomy is now presenting with the symptoms of abdominal cramps, vomiting, and watery discharge. So these are the signs, these are symptoms, and they likely indicate towards that the client is now experiencing obstruction, right? So it's a case of intestinal obstruction, right? So it is imperative that the physician examine the client immediately, right? So now reading the options, tell the client to make an antiemetic, right? Although our client is presenting with vomiting, but it is not advised to provide this client with antiemetics until the examination is done. So not correct. Next is encouraging the client to increase fluid intake to 3 liter per day to replace fluid lost through vomiting. Right. As it is a case of obstruction, so giving this client the fluid levels, it will increase the severity of the symptoms. Right. So this is also not correct. Instruct the client to take 30 ml of milk of magnesia to stimulate a bowel movement. It is also not advised because it will further increase the severity of the symptoms because our client is having obstruction. So oral intake is completely avoided, right? So that's why both of these options are incorrect because oral intake is avoided. Last is notify the physician. Yes, I already told you that these are the signs and symptoms of obstruction. So it is imperative that the physician examine the client immediately, right? So the correct option is notifying the physician, right? Now moving on to the next question. The nurse is changing the subclavian dressing of a client who is receiving TPN, that is total parenteral nutrition. When assessing the catheter insertion site, the nurse notes the presence of yellow drainage from around the sutures that are anchoring the catheter, right? What action should the nurse take first? Okay, so what is TPN? We all know what is TPN. TPN basically is a hypertonic. What is TPN? TPN is a hypertonic high calorie, high protein, IV fluid that should be provided for clients who do not have functional gastrointestinal tract motility. And why it is provided? It is provided in order to better meet metabolic needs of the client and to support optimal nutrition and healing. Right. So, what action should the nurse take first? Right. So, what is the duty of the nurse in this situation? The nurse should first obtain a culture specimen from the drainage, right? The presence of drainage is potential indication of an infection and the catheter may need to be removed, right? So taking culture is important and removing the catheter is the next priority, right? A culture specimen should be obtained and sent for analysis so that treatment can be promptly initiated. Since removing the catheter will not be required in the presence of an infection, the nurse would not clean and redress the area, right? So clean the insertion site and redress the area? No, the nurse should not clean the site because it is advised, it is demanded that the culture is sent from this drainage. So the nurse cannot clean this drainage site, right? So this option is wrong. Next is after the culture report is obtained, the nurse should notify the physician and document all assessments and client care activities in the client's record, right? Document assessment findings in the client's chart. It is the last step after the reports of the culture sensitivity comes, right? Third is obtain a culture specimen of the drainage. Yes, it is the priority. Fourth one is notify the physician, right? So first, the nurse will obtain a culture specimen of the drainage and then send it for analysis, and the catheter will be removed from the site, right? And after the results will come, the nurse will notify the physician and document the findings in the client's chart. So this is the correct way to deal with such kind of situation, right? So moving on to the final question of our day. TPN is prescribed for a client with who has recently had a small and large bowel resection and who is currently not taking anything by mouth, right? So the client is on nil per oral, right? Client is on nil per oral. The nurse should. So before starting this question, let me tell you what is TPN first. What is TPN? TPN is a hypertonic, high calorie, high protein intravenous fluid that should be provided for clients who do not have functional gastrointestinal tract motility in order to meet metabolic needs of the client and to support the optimal nutrition and healing, right? And it is prescribed once daily based on the client's current electrolyte and fluid balance, right? So this is TPN. Now let's read through the options. Administer TPN through a nasogastric or gastrostomy tube, right? So as the patient is on nil per oral and there is small and large bowel resection, so this option is not correct because we cannot let anything enter into the gastric cavity, right? Second is handle TPN using strict aseptic technique, right? So it is advised that the TPN must be handled with strict aseptic technique because of the high glucose content. The TPN becomes a perfect medium for bacterial growth, right? Because of high glucose concentration, this TPN becomes the perfect medium for bacterial growth. So second option is correct so far. Third is auscultate for the presence of bowel sounds prior to administering TPN. There is no specific need to auscultate for bowel sounds. It is not specifically needed. Fourth is designate a peripheral intravenous site for TPN administration. Well, because the TPN is a hypertonic liquid, as I already mentioned, so it must be administered through a central venous access and not through a peripheral IV line. So this option is not right because this TPN is administered through a central venous access. So the correct option out of the four is the second one, that is handle TPN using strict aseptic technique. Right. So thanks for watching this video today, and kindly share this video and subscribe to our channel. Thank you. The first question is, using a sliding scale schedule, the nurse is preparing to administer an evening dose of regular insulin to a client who is receiving total parenteral nutrition TPN. Which action is most appropriate for the nurse to take to determine the amount of insulin to give? Right. So before starting the question, let's first read about slide scale schedule. What is sliding scale schedule? In this, the dose is based on blood sugar levels just before the meal, right? So in case if the blood sugar levels are raised, we need to give more insulin to the patient. And how do we measure this blood sugar levels? These blood sugar levels are measured using glucometer. And we have to use this glucometer to measure these blood sugar levels at least 4 times a day, right? So now reading the options. First one is base the dosage on the glucometer reading of the client's glucose level obtained immediately before administering the insulin. Yes, this statement is correct. The second one is base the dosage on the fasting blood glucose level obtained earlier in the day. No, it does not depend on the fasting blood sugar levels, right? So this option is incorrect. Third one is calculate the amount of TPN fluid the client has received since the last dose of insulin and adjust the dosage accordingly. Well, the nurse can't calculate this insulin dosage by assessing the amount of TPN intake, right? So this is also incorrect. Fourth one is assess the client's dietary intake for the evening meal and snack and adjust the dosage accordingly. Well, the same thing, the nurse can't calculate the dietary intake, right? And that's why cannot calculate the insulin dosage using this dietary intake. So this option is also incorrect. So the right one is first one, that is the base the dosage on the glucometer reading of the client's glucose level obtained immediately before administering the insulin, right? So moving on to our next question. A client with IBD, that is inflammatory bowel disease, is receiving total parenteral nutrition, that is TPN. The basic component of the client's TPN solution is most likely to be, right? So I already told you what is TPN. TPN is a hypertonic, right? TPN is a hypertonic, high calorie, high protein, You have to learn this definition by heart, that TPN is a hypertonic, high calorie, high protein IV fluid, right? That should be provided to clients who do not have functional GIT motility. It is provided in order to better meet the metabolic needs of the client and to support the optimal nutrition and healing. And it is prescribed once daily, right? So this is TPN. Now let's go through the options. An isotonic dextrose solution. No, it is not isotonic. A hypertonic dextrose solution. Yes, as I already told you that it is hypertonic. So the second option is correct. Increasing the concentration. Why and now why it is written dextrose here? Well, increasing the concentration of dextrose will increase its tonicity and making it hypertonic. That's why we prefer a hypertonic dextrose solution, right? And hypertonic solutions are used to meet the body's calorie demands in a volume of fluid that will not overload the cardiovascular system, right? Third option is a hypotonic dextrose solution, right? It is also incorrect. Fourth is a colloidal dextrose solution. Now what are colloids? Colloids are basically plasma expanders and blood products. What are colloids? They are plasma expanders and blood products. So that's why they are not used in TPN. So they have no role in TPN. They are basically plasma expanders and blood products. So fourth option is also incorrect, right? So what is the correct option? The second one, that is a hypertonic dextrose solution, right? Now let's move on to our next question. A nurse is assisting with the removal of a CVAD, that is central venous access device. The nurse should instruct the client to write. So what is this CVAD? Basically the nurse wants to remove this device. So how should the nurse instruct the client, right? Let's read the options. Turn to the left side, exhale slowly and evenly, right? Turn to the right side, take a deep breath and hold it, right? So talking about first and third option, they both are incorrect because the correct position while removal of this CVAD is Trendelenburg position. So Trendelenburg position is the preferred position for central venous access device insertion as well as removal. For both insertion and removal, right? If in case this position is not possible, if not possible, then supine position is sufficient, right? So the preferred position is Trendelenburg, and in case if it is not possible, then supine position. So both the first option and the third option, they both are incorrect. Now the fourth option is take a deep breath and hold it. Well, the client should be asked to perform a Valsalva maneuver. What is Valsalva maneuver? What is Valsalva maneuver? In this, the client is asked to take a deep breath and hold it. Right? So this is Valsalva maneuver, and the client is asked to perform this maneuver during both insertion and removal. And why it is so? Because it increases the CVP, that is central venous pressure during the procedure, and that's why it prevents air embolism, right? So fourth option is the correct one. That is, we have to instruct our client to perform Valsalva maneuver, that is taking a deep breath and holding it, so that it leads to increase in the central venous pressure during the procedure, which will further prevent air embolism. Preventing air embolism, right? So fourth option is the correct one. Second is exhale slowly and evenly. No, this is also incorrect. It has no relevance. So the next question is, the TPN is prescribed for a client with Crohn's disease, right? Which of the following indicate the TPN solution is having an intended outcome, right? So basically they are asking what is the role of the TPN, what is the goal of the TPN, why it is given, right? So let's first go through the options. There is increased cell nutrition. Okay, the client does not have metabolic acidosis. The cell is hydrated. The cell, the the client is in a negative nitrogen balance. Right. So these are options. Now, as I already told you that TPN is a hypertonic, high calorie, high protein IV fluids, and it should be provided to clients who do not have functional GIT motility. It is provided in order to meet the metabolic needs of the client and to support the optimal nutrition and promoting healing, right? And it is prescribed once daily, right? So the goal of TPN is basically to meet the client's nutritional needs. TPN is not used, so this option is correct, and TPN is not used to treat metabolic acidosis, right? Also, if we administer TPN to the client, ketoacidosis can actually develop, right? So instead of treating metabolic acidosis, it can lead to ketoacidosis. So this option is also not correct. TPN is not used to treat metabolic acidosis, but eventually can lead to ketoacidosis in some clients. Right. TPN, as I told you, that TPN is a hypertonic solution because of the components like carbohydrates, amino acids, electrolytes, and some trace elements and vitamins. So it is not used to meet the hydration needs of the client. So this option is also not correct. The last one is the client is in a negative nitrogen balance, right? So the TPN is administered to provide a positive nitrogen balance. So this option is also incorrect. So the correct one is the first one, that is there is increased cell nutrition because the primary goal is to meet the client's nutritional needs, right? Moving on to the next question. A client is receiving TPN solution. The nurse should assess a client's ability to metabolize the TPN solution adequately by monitoring the clients for which of the following signs, right? So let's go to the options first: tachycardia, hypertension, elevated BUN concentration, and hyperglycemia, right? Well, the first two options, that is the tachycardia and the hypertension, they do not indicate clients' ability to metabolize the solution, so they both are incorrect ones. The third one is elevated blood urea nitrogen concentration. This BUN, blood urea nitrogen concentration, indicates the renal status of the client and the fluid balance, renal status, right? So this BUN concentration, it indicates the renal status of the client, and it does not indicate the client's ability to metabolize the TPN solution. So this option is also incorrect. Well, talking about the fourth one, hyperglycemia. Hyperglycemia should be monitored regularly. The client might require small amount of insulin to improve this the glucose metabolism, right? So the client should also be observed, and also as this should be monitored, the client should also be monitored for signs and symptoms of hypoglycemia. Why? Because as hyperglycemia is occurring, for which we are giving insulin, and in case if we give more amount of insulin, then the client can present with symptoms of hypoglycemia. So that's why while giving TPN to our client should be monitored for both hyperglycemia and hypoglycemia. So the correct option out of these four ones is fourth one, that is hypoglycemia, right? And in case if hypoglycemia was also written, then we have to correct both options, right? Moving on to the next one. Which of the following interventions should the nurse include in the client's plan of care to prevent complications associated with TPN administered through a central line? Right. So before starting these questions, what is the complications that are related to TPN? The first complication that can occur in the client is infection. Next one is air embolism. These are the most common complications that our client can have during this TPN administration. So infection and air embolism. So what the nurse can do to prevent these complications is, let's read the options first. Use a clean technique for all dressing changes. Okay. Second one is tape all connections of the system. Third is encourage bed rest. Fourth is cover the insertion site with a moisture proof dressing. Right. So in this first option, it is written a clean technique. Well, the correct statement would be strict aseptic technique. Right. So the nurse should use a strict aseptic technique, not just a clean technique, because there is a major difference between strict aseptic technique and a clean technique, right? So this option is not correct. Second is tape all connections of the system. Yes, this one is correct because all the connections should be taped nicely so that there should be no leakage, right? Third is encouraging bed rest. Well, ambulation and activities of daily living are encouraged and they should not be limited. So this option is incorrect. Fourth one is cover the insertion site with a moisture proof dressing. No, it should be covered with an air occlusive dressing, not a moisture proof dressing. Right? So the correct option will be second one, that is taping all the connections of the system. Now moving on to the next question. The nurse notes that the sterile occlusive dressing on the central catheter insertion site of a client receiving TPN is moist, right? So there is some discharge that is present around the site. The client is breathing easily with no abnormal breath sounds. Okay, so there is no complication so far. The nurse should do the following in order of what priority from first to last, right? So we have to arrange these options according to the priority, right? From high priority to the lowest priority. So in TPN, the potential complication could be a leakage or catheteric puncture, right? This is a potential complication leakage. This is what is happening in this question, that there is some leakage, right? So to prevent this leakage, the nurse should take appropriate measures, and according to the priority, these are: the nurse should first notify the physician, right? First of all, notify the physician, that is the third option. After that, and after notifying, the nurse should prepare it for changing this catheter, and then if pneumothorax is suspected, there the nurse should position a roll towel under the client's back. So this is the next step. And if there is drainage at this side as it is indicated in this question, then the nurse should obtain a culture, right? So this is the third one. And at last, the nurse should change the dressing, right? So this is the fourth one. So the correct priority will be third, then fourth, then second, then first. So this is the correct answer. So in case there is drainage at the insertion site, the nurse should first notify the physician, and after that, if pneumothorax is suspected, then the nurse should position a rolled towel under the client's back. After that, if there is drainage, then the nurse should obtain a culture sample from the site and send it for culture sensitivity. And the last step will be changing the dressing. So this is the correct priority order, right? Let's move on to our next question. The nurse administers fat emulsion solution during TPN as prescribed based on the understanding that this type of solution provides essential fatty acids, provides extra carbs, promotes effective metabolism of the glucose, and fourth one is maintains a normal body weight, right? So admission of this fat emulsion solution, it provides additional calories and essential free fatty acids which is required to meet the body's energy needs. So first option is correct one. Providing extra carbs. Well, as this solution, fat emulsion solution provides fatty acids, and these fatty acids are basically lipids. So carbs is incorrect. Third is promoting effective metabolism of glucose. Well, fatty acids do not aid in the metabolism of glucose, so this option is also incorrect. Fourth is maintaining a normal body weight. Although fatty acids are necessary for meeting the complete nutritional status of the client, but these fatty acids, they do not help in maintaining the body weight, right? So this option is also incorrect. So the correct one will be providing essential fatty acids, right? Now moving on to our next question. Which of the following should the nurse interpret as an indication of a complication after the first few days of TPN, right? So after the TPN therapy, there will be few complications. So to interpret the indications of these complications, what will nurse do, right? So the first option is glycosuria. Second is a 1 to 2 lb, that is 0.45 to 0.9 kg weight gain. Third is decreased appetite. Fourth is elevated temperature, right? Well, vital signs, they should be taken every 2 to 4 hours after initiation of TPN therapy to detect any early signs of complication. So it is very necessary to monitor the vital signs every 2 to 4 hours after the TPN therapy so that early complications can be prevented, right? So first option is glycosuria. It is to be expected initially until the pancreas adjusts by secreting more insulin, right? So it can occur as early complication, but it will get corrected on its own because the pancreas adapts by secreting more insulin. So this is not a complication, right? Second is gradual weight gain suggests that client's nutritional status improves, right? So this is also not a complication. Third is decreased appetite. Well, decreased appetite is quite normal after this TPN therapy. So this is also not the correct one. Fourth is elevated temperature. Elevated temperature can be an indication of an infection at the insertion site or in the catheter. Okay, so this option is correct because it indicates infection, which is a complication. Right. So what are the complications of TPN therapy? They are acid-base imbalance, acid-base imbalance, then dehydration, increased serum triglycerides, increased serum lipids, increased serum ammonia, then hypoalbuminemia, hypo or hyperglycemia, electrolyte imbalance, and liver toxicity. So these are the few complications that our client can have post TPN therapy: acid-base imbalance, dehydration, increased serum triglycerides, increased serum lipids, increased ammonia levels in the serum, hypoalbuminemia, hyperglycemia, electrolyte imbalance, and liver toxicity. Right. So thank you for watching this video. We will discuss few more questions next time. Thank you. Which of the following adverse effects occur when there is too rapid an infusion of TPN solution? Right. So let's first read the options: negative nitrogen balance, circulatory overload, hypoglycemia, and hypokalemia. Now this is an easy question. The negative nitrogen balance occurs in nutritionally depleted individuals, right? It occurs in nutritionally depleted individuals and it has no correlation with TPN. So this option is incorrect. Second one is circulatory overload. Yes, this is the correct one because if we give TPN solution too rapidly, it causes circulatory overload. That's why it is advised that the client should be assessed carefully for indications of excessive fluid volume. So what are the indications for the excessive fluid volume? These are edema of the arms, legs, face, then the abdominal swelling, increased BP, high BP, then shortness of breath, stomach bloating. So these are the few indications that can happen in a client. So the nurse should look for these indications, right? And third option is hypoglycemia, and fourth is hypokalemia. Well, when the TPN is administered too rapidly, the client is at risk for receiving an excess of dextrose and electrolytes. So increased dextrose will result in hyperglycemia, and increased electrolytes will re- result in hyperkalemia. So these options are also incorrect. So the correct one is second one, that is circulatory overload. Right. The next one is following the acute stage of diverticulosis, which foods should the nurse encourage a client to incorporate into the diet? Select all that apply. Right. So this is a question with multiple answers. Right. What is diverticulosis? Diverticulosis is the presence of diverticula. Now, what is diverticula? Diverticula is basically a small bulge pouching, small bulge pouch that can form in the intestinal lining. Intestinal lining, and the most common part of the intestine that is affected is the large intestine, and that is colon. So diverticula is basically the presence of small bulging pouch that is formed in intestinal lining, that is in colon of the large intestine. So this is diverticula, and the condition is called diverticulosis. And when this diverticula gets infected or inflamed, it converts into diverticulitis, and the patients with diverticulitis presents with abdominal pain, nausea, vomiting, and constipation. So the client should be encouraged to follow a high fiber diet. So we have to choose the correct options, basically those options which are rich in high fibers. So bran cereal, it is rich in high fiber. Broccoli is also rich in high fiber. Tomato juice is a low fiber diet. Navy beans is also high fiber diet. Cheese is also low residue, right? So the correct options are first one, second, and the fourth one, right? Let's move on to the next one. Which of the following laboratory findings are expected when a client has diverticulitis? I already told you what is diverticulitis. It is the inflammation of the diverticula. And what is diverticula? It is basically a small bulging pouch that is found in the intestinal lining, that is in the colon of the large intestine, right? So what are the laboratory findings? Elevated red blood cell count. Well, it has no relation with diverticulitis. It is mainly found in individuals with polycythemia vera, or in case if there is any fluid deficit. So this option is incorrect. Second one is decreased platelet count. This occur in conditions like aplastic anemia, dengue, and some malignant blood disorders. So this option is also incorrect. Elevated white blood cell count. Yes, this option is correct because as diverticulitis is an inflammation of the diverticula, basically it's an infection, and in infection, the WBC count rises. So third option is correct. And fourth one is elevated serum blood urea nitrogen concentration. Well, this serum blood urea nitrogen, in case it is elevated, it is associated with renal conditions, and diverticulitis has nothing to do with renal condition. So fourth option is also incorrect. So the correct one is the third one, that is the elevated white blood cell count. Right. Moving on to the next question. A barium enema is not prescribed as a diagnostic test for a client with diverticulitis because a barium enema. Right. So now they are asking about the barium enema. Right. So let's first quickly read the options. Can perforate an intestinal abscess. Perforate would greatly increase the client's pain, right? Is of minimal diagnostic value in diverticulitis, and the fourth one is too lengthy a procedure for the client to tolerate, right? So barium enemas and colonoscopies, they both are contraindicated in clients with acute diverticulitis because they increase the intestinal pressure and can lead to perforation of the colon and can eventually cause peritonitis, right? So barium enema or other surgeries of colon like colonoscopies, what they can do, they will increase intestinal pressure. As a result, they can cause perforation and finally leading to peritonitis. So first option is correct, that is it can perforate an intestinal abscess. Second one is would greatly increase the client's pain. Yes, a barium enema could increase the client's pain. However, that is not a reason for excluding this test. So second option is not correct. Is of minimal diagnostic value in diverticulitis. This statement is wrong because barium enema is diagnostic in diverticulitis, but we usually not prescribe it. So that's why third option is also incorrect. And the fourth one is too lengthy a procedure. No, it is not lengthy. So fourth option is also incorrect. So the correct one is the first one, that is it can perforate an intestinal abscess and finally cause peritonitis. Right. Moving on to our next question. The nurse should teach the client with diverticulitis to integrate which of the following into a daily routine at home. Right. So at this point, you already know what is diverticulitis and how the patient with diverticulitis presents. Just revising a little bit, diverticulitis is basically the inflammation of the diverticula, and diverticula is a small bulging pouch that is present in the colon of the large intestine. And when it is inflamed, it is called diverticulitis, and the patient presents with abdominal pain, nausea, vomiting, and constipation. Right. So now, what they are asking is what should the nurse teach the client to add into his daily routine, right? Using enemas to relieve constipation. In the previous question, we read that enemas are contraindicated because they increase intestinal pressure and can lead to peritonitis. So, enemas are contraindicated. So, this option is incorrect. Next is decreasing fluid intake to increase the formed consistency of the stool. As I told you that the patient with diverticulitis presents with nausea and vomiting. So that's why we cannot decrease the fluid intake. Instead, the fluid intake should be increased to promote the soft formed stools. So not decreasing, it should be increasing. So this option is also incorrect. Third one is eating a high fiber diet when symptomatic with diverticulitis. This option is correct, right? And the fourth is refraining from straining and lifting activities. Yes, this option is also correct because doing this straining and lifting activities, it can increase the intra-abdominal pressure, right? It can increase the intra-abdominal pressure and it may precipitate an attack. So the correct options are third one and the fourth one, right? Now moving on to the next question. After instructing a client with diverticulosis about appropriate self-care activities, which of the following client comments indicate effective teaching? Select all that apply. Right. So the nurse instructed the client regarding diverticulosis, and now the client is commenting, and what comment indicates effective teaching? Right. So the first is with careful attention to my diet, my diverticulosis can be cured. Okay. Well, if the client pays careful attention to his diet, his diverticulosis can be controlled, but it cannot be cured. So it should be controlled, right? So that's why this option is incorrect. Second is using a cathartic laxative weekly is okay to control bowel movements, right? So avoid this the regular use of the cathartic laxatives. It is not advised to take it on a regular basis, whether it is weekly or on alternate basis. It is not advised, right? Instead of this, the client should take bulk laxatives and stool softeners. So these bulk laxatives and stool softeners may be helpful to maintain the regularity of the stools and decreasing the strain to the patient. So this option is also incorrect. Third one is I should follow a diet that's high in fiber. Yes, this option is correct. And what are the sources of high fiber diet? You already know. Those are bran, then broccoli, and navy beans, right? Fourth is it is important for me to drink at least 2000 ml of fluid every day. This is correct because it promotes soft form stools. Fourth option is also correct. And the last one is I should exercise regularly. Yes, it is recommended to exercise regularly, but not in an extensive manner, right? So this option is also correct. So out of the five options, the correct ones are third one, fourth one, and the fifth one, right? Now moving on to the next question. A client with diverticular disease is receiving psyllium hydrophilic muciloid, that is metamucil. The drug has been effective when the client, right? So what is this metamucil? It is basically a bulk laxative, and I already told you that bulk laxatives are quite helpful when the patient is having diverticulitis or diverticular disease because what they do, I already told you what they do. They help in promoting soft form stools, right? And they decrease the strain on the patient, right? So, what is the role of this bulk laxative? Now, first, let's read the options. Passes stool without cramping. This option is correct. Second one is does not have diarrhea. No, bulk laxatives do not manage diarrhea, so it has no relation with diarrhea. Third is no longer anxious. No, it has no relation with anxiety problems. does not expel gas. No, it does not manage this gas problems. So the correct one is first one. Now, instead of this medical management, what other conservative management we can do is we can advise a patient to have a high fiber diet. You already know this, right? In high fiber diet, he can take bran, broccoli, or navy beans, right? What does this high fiber diet do? It basically decreases the intraluminal pressure, right? So intraluminal pressure is decreased, and which makes it easier for the stool to pass through the colon, helps in stool passing, right? So the correct option is the first one, that is passes stool without cramping or without straining, right? Now the moving on to the next question. A nurse is providing wound care to a client one day following an appendectomy, right? What is appendectomy? It is basically the removal of the appendix. Appendectomy is removal of appendix. A drain was inserted into the incisional site, okay, during surgery. Which action should the nurse perform when providing wound care? So basically they are asking about the nurse role while providing wound care, right? Now quickly let's read the options. Remove the dressing and leave the incision open to air. Well, the nurse cannot leave the incision open to air because it can increase the risk of infection, increasing the risk of infection. So this step is incorrect. Second is remove the drain if wound drainage is minimal. The nurse should note the amount and the character of the wound drainage and the color of the wound drainage, the consistency of the drainage. But only surgeon has the right, only surgeon will determine whether to remove the drain or not. So this option is also incorrect. Third is gently irrigate the drain to remove exudates. No, it is not advised to irrigate the surgical wound drains. So this option is also incorrect. Fourth one is clean the area around the drain, moving away from the drain, right? So the nurse should gently clean the area around the drain by moving in a circular motion away from the drain. Just look here, if it is a drain, so the nurse should clean the area in a circular manner, like and moving away from the drain, so that the infection can no longer go into this, so it prevents the risk of infection, right? So the correct option is the fourth one, that is cleaning the area around the drain while moving away from the drain in a circular manner, right? So thank you for watching this video. Kindly subscribe and stay focused.